Injury to the lungs, that is another. Apart from the cage, we have substantial impact on the chest, then can cause injury to the lung. Maybe beneath area impact, that is coup and counter coup injuries here. Coup is the where the injury happens, and the counter is the on the opposite side of that. These kind injuries can be deceleration injuries or fall or in traffic accident along the posterior lateral aspect where the vertical line of subpleural bruising occurs, often in the paravertebral gutters. Outline of the ribs can be seen on the lungs and the contusion, and we can see that these impressions are there on the lung. Bruising may cause subpleural blood blisters. Some blisters can be formed at the lung, at the junction of the lung and the chest cavity or the ribs. So there can be bruising due to rubbing of the lung and the chest ribs. Laceration of the lung can occur in blunt injuries. Even lobes or part of the lobes may be detached. Vessels in the hilum. Hilum is the portion through which all the vessels and the bronchi that goes inside the lung. They can cause hemorrhage, mediastinal hemorrhage, interpleural hemorrhages, or there can be pincer contusions. These are the contusions of the lung which get trapped in the angles of the diaphragm, costophrenic angles. So it is called pincer contusions. In children, lung injuries can occur without fracturing of the ribs because of constant shaking. Sometimes kids are being so shaken, the lungs can damage, but the ribs may remain intact. The wounds may be through and through injuries that emerge through the emerge to cause further damage. It can be any object can pass through and can cause the damage. Injuries to the heart, it is very important. Some of the stab wound or the gunshot wounds can penetrate the heart and its related structures, like anywhere in the pericardium, adjacent areas or sternum can be penetrated. These all can lead to the injury of the heart. It can be laceration, contusion or stab wound depending upon the impact. Most stab wound enters intercostal spaces. It is very easy to penetrate through the intercostal spaces through a rib fracture or a costal cartilage. Any of the factors can be there in the injury to the heart. A stab wound causes injury to the right ventricle, which is very thin and can lead more blood extravasation. The anterior intraventricular septum which is lying in the front. The structures which are lying in the front are left atrium, right ventricle, left ventricle and anterior interventricular septums. These can all be injured. A shallow stab wound may enter the myocardium and not reach the lumen of the vein. So it may not reach the injury is up to this level, it may not reach the lumen. So blood will not come out and this may heal or auto seal with time. Stab wound injury to the ventricles, right ventricle, thin walled, knife passes into the heart cavity, copious bleeding into the pericardial sac that can lead to cardiac tamponade or restricting of the cardiac expansion, and that can further lead to decreased cardiac output and that can lead further to the death. Left ventricle, layered thick wall may partly or wholly seal the wound. Bleeding can be slight. If the drainage from the pericardial wound is less than the leakage from the ventricle, eventually cardiac tamponade will develop. This is the one of the diagram which shows that there is a penetration of the knife in the left atrium. Then again it is the penetration into the pericardium and further can lead to development of cardiac tamponade. Here is the wound. It can lead to the accumulation of the blood in the cardiac coverings, that is called pericardium. Many stab wounds of the heart are transfixing, sometimes complete through and through injury to the heart. That can be, it is called as transfixing. If the left ventricle carries both the wound, then rapidity of bleeding will not be torrential. Sometimes the left ventricle is auto-sealing effect because of the thick wall, but there are chances that it can lead to death. Some of the wound pass downward and transfix the heart, then exit through the lower wall of the right ventricle and pass via the diaphragm into the liver. Sometimes somebody pushes the weapons and pushes downward, and it can cause all the heart structure to get cut, and it can also cut the diaphragm and cut the liver, other part also. So any type of the phenomena that you can imagine that a stab wound can cause. So underlying structures like heart, like lungs, liver, spleen or the stomach, all can be damaged depending upon the direction of the force applied, pull and push, depending upon the amount of the force applied. Blunt injuries of the heart, that can lead to laceration in case of a traffic, that can lead to contusion, fall from the height, stampede, heavy impact such as punching. This can cause heart to damage an intact chest, especially in the child, in the pliable thorax. In road traffic accident, we have seen the cases that the drivers due to sudden deceleration their heart can be bruised and completely pushed and laid out in from its mediastinum to the thoracic cavity. So there are different displacement, different bruising depending upon the amount of force applied or the deceleration force. There can be heart damage in intact chest cage, especially in child. Fatal blunt damage of the heart may occur without a mark or the skin. Cardiac injuries are usually on the front of the bone. Most of the time cardiac injury is because of its either attack from the front or due to deceleration, the cardiac structures come out from its attachments and strike to the sternum or the other structures underneath it. Posterior bruising or laceration can occur if the heart is compressed against the thoracic cavities. It's quite uncommon. Stamping assault happens when there is somebody is punching on the heart or somebody is fallen and people are running over them. Steering wheel impact in the car, transport injuries. All degrees of damage can occur from mere epicardial bruising to laceration that open the ventricular lumen widely. Interventricular septum can be ruptured. In aircraft crashes, whole heart may be avulsed from its roots, so found lying loose in the thorax, that I have already discussed. It can lie loose in the thorax. Hemopericardium or cardiac tamponade, accumulation of the fluid in the pericardial sac. So it is it may be because of the disease, rupturing of any old healed MI, rupture of the dissecting aneurysm or injury to the chest. When the damage has been caused by the step or perforating wound, penetrating pericardial sac wound, that can lead to accumulation of the blood into the pleural cavities, mediastinum, even abdomen, depending upon the perforation or the injury of the diaphragm. Cardiac tamponade develops, we have discussed, blood accumulates in the pericardial sac faster than it can escape. Accumulation is fast, accumulate faster than it escapes, either because of the bleeding rate exceeds the drainage, exit hole in the pericardium become blocked by clot, clot has blocked the exit hole, so there is constantly increase in the pressure in the pericardial sac that can lead to restricted expansion of the heart. In each systole and diastole, there are the chances that the cardiac contraction can be reduced because of the increased pressure in the pericardial sac. In bleeding from contusion or laceration of the heart, no escape route for the sac, pressure in the pericardial sac increase, preventing the passive filling of the atria during diastole. So, when there is a constant pressure on the pericardial sac, then which is the filling from the venous circulation in the heart, it stops. So, if blood is not coming, then the blood will not go out. So, whole of the phenomena of the heart contraction and relaxation will be hampered. Death may follow because of the cardiac tamponade. This is the accumulation of the blood in the pericardial sac. We can see the anatomy here. So, blood can accumulate in the pericardial sac. This is another diagram. This is a normal anatomy. This is the blood accumulation in the pericardial sac. This is again increase in the blood accumulation and leading to decrease volume expansion and decrease filling and systole of the heart. Injuries to the great vessels like that of aorta, it is quite dangerous to the life. It happens in the road accident because the posterior part of the aorta is attached to the spine through the fibrous structures. So, if there is a sudden changes in the inertia, it may rupture or transect and cause massive bleeding in the chest and can lead to instant death. Aorta commonly suffers injury in the deceleration, road traffic accident, air accident, fall from the height. When the thorax is suddenly decelerated, literally chest structures are mobile, like heart is mobile, but the aorta is fixed somewhere. But since heart will be pulled, aorta will also be pulled. So, it can cause severe traction at the root of aorta, complete or partial rupture of aorta in the descending part. Generally, if it is hard, then the aorta comes out in this manner and it is get attached to the spine here, attached to the spine with the fibrous structure, and this part, when the heart is moving, this part get traction and there are chances that at this part it can be pulled out and multiple fracture of the multiple tear in the aorta can happen. So, we have to be cautious enough to examine it like this. There is a rupture at this side because of the pull of the heart, and ladder rung tears are present in the aorta because of its attachment to the spine. Lower thoracic aorta is closely bound to the anterior longitudinal ligament. Weak point and traction occur at this level. Clearly that it does look like surgical incision. Tear is annular at right angle to the axis. This is called as ladder rung tears. In deceleration trauma, only the intima or the inner media can be damaged. Found without major transaction, death is delayed, false aneurysm can develop, dissection of the aorta can happen, and chances of that person may die because of that. Pulmonary artery or the vein or the branches of the pulmonary artery can get damaged. Great vessels are often involved in stab wound. Stabs can pass through directly into the arch of aorta. Even the shallow injury may reach the aorta, can cause death. Other stab wound may injure heart valves, large primary branches of the pulmonary arteries and veins, causing gross bleeding. So all the injuries can lead to gross bleeding in the chest cavity and can hamper the phenomena having in the chest cavity, that is the respiration and the cardiac activity. We will be having a stop today here and continuing with the abdominal injuries in the coming lectures.